It's pretty amazing when you think about it. Thanks to incredible veterinary care and just how much better we've gotten at looking after them, our pets are living way longer than they ever have before. We're getting more time, more years with our best friends, which is just the best gift ever. But it also brings up a really important new question.
Right? Are we making sure that all that extra time is actually good time? Time filled with comfort and joy and energy. And that's really what we're going to get into today. It's all about shifting our focus from just a longer life to a better life in their golden years. So let's dive in.
Here's our roadmap. We'll start with what this gift of extra time really means. Then we'll get into decoding the subtle signs your pet is sending you. We'll pull back the curtain on the geriatric checkup, look at the most common health challenges, and then build your very own senior care toolkit. And finally, we'll talk about the most important role in all of this, yours. So this extra time we're getting, it's amazing, but it also comes with a new kind of responsibility. See, as our pets hit those senior years, which is generally around age 7, they're just more likely to develop chronic conditions. And a lot of these are what we call silent diseases, meaning they creep up so slowly you barely even notice them. And that makes spotting them early our biggest challenge, but also our most powerful tool.
This is where you come in. You are the #1 detective in your pet's life. It's just so easy to see a change on our older pets and chalk it up to them just getting old. But so often, what we think is a normal part of aging is actually a critical clue about what's really going on with their health.
Let's start with the classic. You notice your dog's just sleeping more, seems more tired, less interested in playing. It is so easy to think, well, they're just slowing down. But that lethargy can actually be one of the very first signs that something else is brewing under the surface.
Or, how about this one? You feel like you are constantly filling up that water bowl. This is a huge one, folks. If you notice a real increase in how much your pet is drinking and, well, peeing, that can be a major red flag for developing issues, especially with their kidneys.
And what about when you're out and about? Are they a little slower to get up from a nap? Are they lagging behind on your walks? This isn't just them being less energetic. It could be a really clear signal of pain from something like arthritis, or it could even be a hint about their heart health.
So, here's the big takeaway. These little changes, they're not just your pet getting old. They're whispers. It's their way of telling you, in the only way they know how, that something has changed. And our job as their people is to learn how to listen to those whispers before they turn into shouts. So how do we figure out what those whispers mean? We do it by teaming up with our veterinarian. The geriatric checkup is way more than just a routine visit. Think of it as a full-on health investigation, designed specifically to find the answers we need for our aging pets. And this isn't just a quick look over, it's a really deep dive. It starts with a hands-on physical and a good look at their teeth. Then comes comprehensive lab work, blood and urine tests that give us a detailed picture of how all their organs are functioning. From there, imaging like X-rays or ultrasounds lets the vet literally see what's going on inside, and sometimes they'll do specialized tests for the heart or eyes. It's a complete 360-degree health snapshot.
And how often should this happen? The recommendation is crystal clear. Every 6 months. I know, that might sound like a lot, but remember, one of our years can be like 5 to 7 years for them. So checking in every 6 months is absolutely crucial for catching problems early, which is when we can do the most good.
Okay, so when your vet uses this amazing toolkit to investigate, what are they usually looking for? Well, it often comes down to one of a few common culprits. Let's talk about the 3 most common silent conditions that these checkups are so good at finding.
First up, and this one is incredibly common, is osteoarthritis. It's a slow burn disease where the cushiony cartilage in their joints just wears down over time, and that leads to bone rubbing on bone, causing the pain and stiffness that makes them reluctant to move. It's that slowing down we were just talking about.
But here's the great news. There is so much we can do to help them feel better. We can't cure it, but we can absolutely manage it. The goal is to reduce their pain and keep them moving. That means keeping them lean, doing gentle exercise like swimming or short walks, using vet-prescribed meds, and maybe adding in some joint supplements.
Even simple things at home, like putting down rugs on slippery floors, can make a world of difference.
All right, next up is a really big one, especially for smaller dogs: mitral valve disease. It's the most common heart problem we see. Basically, the little valve between two of the heart's chambers starts to wear out, so it doesn't close tightly anymore. This lets a little blood leak backward every time the heart beats, and it happens so gradually, it's often silent for years.
And this right here is a perfect example of why those regular checkups are an absolute game changer. The very first clue is almost always a little heart murmur that your vet hears with a stethoscope, long before you'd ever notice anything is wrong at home. A later sign, like a nagging cough, often means the disease is already pretty far along. And our third usual suspect is chronic kidney disease. This is another classic silent problem. Over time, the kidneys just slowly lose their ability to filter all the waste out of the blood. And remember that whisper about drinking more water? This is a huge reason why. The body is desperately trying to flush out all the junk that the kidneys can't handle anymore. Now, let's clear up a really common misunderstanding when it comes to diet for kidney disease. It's not about cutting out protein entirely. It's about feeding them a better quality of protein, one that's easier to digest and creates less waste for the kidneys to clean up. At the same time, you really have to limit things like phosphorus and sodium, because the damaged kidneys just can't get rid of them. And adding wet food is a great trick to keep them hydrated.
Okay, so we've learned how to listen for the whispers, we know what the usual suspects are, so what do we do about it? Now it's time to put it all together into a simple but really powerful action plan.
It really boils down to these three things, the three pillars of senior pet care. Number one, consistent vet visits. Put that 6-month checkup in your calendar right now. Number two, targeted nutrition. Talk to your vet about the perfect food for their age and their specific needs, and make sure they're getting plenty of water. And number three, lifestyle adaptations. Gentle exercise to keep them moving, and a comfy, safe home to support them. That's it. It's that straightforward.
And all of this leads to maybe the most important point of all. This is about changing your mindset. You are not just a passive worrier watching your best friend get old. No way. You are their number one advocate, you're their lead detective, you are their empowered partner in health.
Because that's what this is really all about, isn't it? Being proactive isn't about trying to stop them from aging. It's about helping them age with grace. It is truly the ultimate act of love, making absolutely sure that their golden years are, well, truly golden.
So I'll leave you with this question. The next time you're just hanging out with your senior pet, really watch them. Listen closely. What whispers are they sharing with you today?